Hi, my name is Dr. Tony Salamay. I have an office here in Panama City, Florida. We're treating people with back pain, neck pain, chronic health conditions such as fibromyalgia, chronic fatigue, diabetes, and a whole host of other conditions. I hold a master's degree in nutrition, and we treat people with chiropractic neurology, and we treat people with metabolically through nutrition. Well, today we're going to be talking about back and neck pain, and a lot of people experience back or neck pain. About 80% of the population is going to have, and this is a study, 80% of the population is going to have back or neck pain at least one time in their life. So first of all, let's find out what is back pain and what causes back pain. First of all, back pain can be caused by a lot of things. A lot of things that we're familiar with is trips, falls, car accidents, improper posture, repetitive use. All of these things can cause back pain. So when we look at the macro trauma, those are like the big stuff, like collision sports, the big falls, the car accidents, airbags being deployed. All these things are big traumas. Punches, martial arts, karate. All these things can create significant trauma to the body, to the nervous system. Another thing that people don't really see a lot is that the repetitive use or improper posture creates back pain, like such as sitting on the computer wrong and doing this for extended periods of hours at work. Picking up their kids wrong, holding, little kids carrying their book bags, on one side. And, these kids carry these heavy, 5-pound books, each one weighs about 5 pounds. That creates significant amount of stress on the spine. And over time, it leads to back issues. It leads to mechanical problems of the spine area and on the nervous system. So another thing is sleep. And we're beginning to realize that we sleep, a quarter of our lives. We spend it in bed. So, when you're sleeping wrong, if you're sleeping on your stomach and you're turning your neck and you're doing that for, extended hours, and you're in that position for, 3 or 4 hours or even less, you can create significant amount of problems to the neck over the course of months and even years. So sleeping right is very important. So that's part of the micro trauma, or the little things that happen over time that can create these back issues, and they can create degeneration and so forth. So we have a lot of we talked about physical stresses that can cause back pain and neck pain. What about the chemical stresses? What about the emotional stresses? So the chemical stresses are, you're looking at food sensitivities, food allergies. We're looking at heavy metals. We're looking at toxicity levels in the body. All of these things can create problems in even affect back problems. And the way it doesn't do it directly, but through the inside, through the internal. And that's something that we address in our office, is that we're looking at internal things that can also contribute to the back pain and back problems, such as, for instance, the stomach or the heart will contract the left shoulder. So people with chronic stomach problems or heart issues or anything like that can have a significant amount of left shoulder pain, and they're not even aware that they may have a stomach problem or have a heart problem until they get diagnosed later on, either through an EKG, or they may have some acid reflux or heartburn that they're not, they're not really extremely aware of, and that can happen until the signs and symptoms become more significant. Then they start realizing about their problem. But a lot of these things show up in the spine early on, before it actually manifests itself into an actually chronic disease or chronic health condition. So and then we shift to emotional things that can cause back pain. Obviously, stress, such as anxiety, thinking, arguments. All these things depression. All these things can affect our organ systems and cause problems in the musculature of the body. So really, in our office, what we do is we look at you as a whole person. It's not just, we're not looking at you from a bone or muscle perspective. We're looking at you as a being, as a chemical, physical, mental, and spiritual being as a whole. So that's very important in order to find out really where's the source coming from, because our focus is to fix the root cause. Because if you don't fix the cause, what happens? You never fix the problem. So you'll have to remove and find out the source in order to get lasting results. So that's what. Now let's talk about the medical profession and how they treat back and neck pain. And obviously you may know if you've had back and neck pain in the past, or or right now you're watching this video and you have back or neck pain, they probably give you medications. A lot of these medications, it can be cortisone shots, can be pain meds like narcotic medication, and these things can even be addictive, let alone the big side effects that occur from these pain meds. So a lot of pain meds can be a big issue when it comes to back pain. They're taking it and it's only masking the problem. The cortisone shots, they can create osteoporosis, they can cause decreased immunity, and the list can go on and go on. So medications are usually never the best way to really address the back or neck problem, because it's not going to fix the cause. Our body it's not, medications are not supposed to replace toxicities or deficiencies, because they are toxins and they do nothing to really correct what's going on or restore the function of the body. So pain meds can be used for a period of time, but they're not meant to be used and used and used. And what's happening is that we're finding patients that they're coming from all these different clinics, which are orthopedic clinics, neurological clinics, pain clinics, and they're constantly drugged up and they're not getting better. And in fact, their problem's getting worse, because what happens is, by you not addressing the cause of the problem, they're continuing to consume this and they're continuing to use their body and make the problem worse. Because pain is a sign that our bodies it's telling us something, that there's something going wrong. You can just imagine if you had your hand on the stove and the fire is going and you're talking in a conversation and you didn't realize that your hand was on the stove because you had no pain sensation, you would lose your hand. So we need to thank Mother Nature, thank God that we do have pain, because it is an alert, it is a warning sign that tells our body that there's something going wrong. So also another thing that used to be treated in the conventional model is surgery, and there are times where surgery is rendered and it's important. It can be at times helpful and be needed and required, but for the most part, and these are statistics, about 70 to 80% of the surgeries are actually for back and neck pain are actually have a very low success rate, if not failure rate. So surgeries are you always want to have that as a last resort, because anytime you cut in or use the knife to get in, people are usually never the same after that, and it's really very invasive and it can be very risky. So if you're watching this video and you're having pain, or you're having discomfort, or even you have a chronic health condition and you're not sure of what to do, feel free to give us a call. My phone number is 850-785-9372. Our staff will set up a consultation. It'll be complimentary. And just say that you will watch this video and you're interested in getting some more information. Jot down your questions. We'll sit down and I'll tell you what I can or can't do for you. My name is Dr. Tony Salamay, and have a great day.